First at 5 today, the Alabama Department of Public Health is hoping a new program will help gain some insight on the high number of maternal deaths in the state.
Alabama's maternal mortality rate is one of the highest in the nation. Experts believe their autopsy program will help lower the death rates. News 19's Archie Snowden spoke to ADPH about the program and joins us in the studio with all the details.
That's right, Tamika. The ADPH is hopeful of gaining a greater insight into the cause of maternal deaths. 50% of all maternal deaths in the state do not have an autopsy, and it's presented a problem when trying to study the causes of these deaths.
Alabama's maternal mortality rate is one of the highest in the nation. A recent review by the Alabama Maternal Mortality Review Committee shows facts that alarmed the Alabama Department of Public Health.
And unfortunately, at least 50% of the deaths we look at have no autopsy.
ADPH State Perinatal Director Carolyn Miller says that autopsies are the key in their reviews. Knowing why women in Alabama are dying at such a high pregnancy rate will help them to understand what can be done to help prevent these deaths. Through the implementation of the maternal autopsy program, family members of women who died during pregnancy or up to a year after delivery are offered a complete autopsy free of charge if there is no one to perform the autopsy in the area or cannot afford one. In a review from the ADPH in 2018 to 2019 found that 93 deaths in that span seemed to fit the parameters of their study, and they determined that 24 of those deaths were pregnancy related. Most women lived in rural Alabama.
We have a lack of access to care in our state. Many of our rural counties do not have an OB/GYN to see, nor do they have a labor and delivery hospital. And we had 3 hospitals, labor and delivery services closed last year.
With that in mind, coroners in several counties announced their participation in the maternal autopsy program.
When they were called to a death that is someone who was pregnant or delivered after a year, they can let the family know about the program. Of course, it's up to the family whether they want the autopsy or not, but it would help them to get some answers as well. And so
ADPH plans to expand the availability of the maternal autopsy program statewide in the coming months.